Hello and a warm welcome to everyone who's joined us today. It's my pleasure to welcome the editors and authors of the book Community Economy and COVID-19, which was published recently and which forms the basis of our discussions today. A couple of housekeeping points before we move ahead. We'll be recording the event, so those who are unable to join the live talk can view it later via the Cassini event link. And after the individual presentations, we'll be opening up the webinar for Q&A. However, you can add any question through the event via the chat box. Please indicate if your question is meant for a particular speaker, and please keep yourselves muted throughout the talk unless you're speaking. I will be your host today. My name is Shinjini Chatterjee, and I'm the publishing editor of Springer's Wellbeing and Quality of Life program based in Germany. It's a wonderful opportunity for me to introduce this very topical and important book and today's discussion theme, edited by Clifford Schulz, Dawn Ratz, and Joseph Sergi. This book is a product of our long-standing and cherished partnership with the International Society for Quality of Life Studies. It's published in the collaborative series Community Quality of Life and Wellbeing, edited by Rhonda Phillips. Now, the pandemic not only ravaged people's lives, but its effect on community life and support was catastrophic in many cases. Yet, people and communities rose to the challenge. New and resilient means of handling crisis developed during this time. The book takes off from the salient point to discuss the learnings for communities and the road ahead.
So, we were charged to put things together, synthesize things, and learn from all the different authors, from the different scholars, and my goodness, quite a bit of information that was analyzed and put together to try and move forward. In essence, what we tried to do in the epilogue chapter was to synthesize things in such a way not to just generate policy ideas in terms of best practices, but also set a research agenda for scholars to test some very specific theoretical proposition that came out of this kind of analysis. What we did is we were able to capture many of the strategies that were used in the different countries in terms of the types of catalytic institutions. And from the, when we're talking about government and we're talking about the public health system interventions, we, of course, uncovered all the different strategies that were used in different countries and different communities. And they go from social distancing to wearing masks and mask provisioning, all the way up down to hospital and health system restructuring. So there are all kinds of good strategies that we learned from different communities in different countries. In terms of specific governmental interventions besides the public health system interventions, again, government kind of played the role of generating mandates to ensure that those public healthcare systems were effective. And therefore, those mandates were directives to ensure the effective implementation of health interventions, from accelerating vaccine development and production, all the way down to communication campaigns, support, and funding. So there's a whole bunch of different interventions that, again, government developed in order to accelerate those mitigation strategies that have been, of course, developed by the public healthcare system in different communities and in different countries. There were also mitigation strategies by other catalytic institutions, such as, again, non-NGOs. And here in that context, we were able to uncover strategies from the medical infrastructure institutions, such as hospital clinics and testing labs and so forth. There's a whole bunch of different catalytic institutions were involved here. Also, the business community was very much involved. Organizations reconfiguring workspaces and allowing remote work, implementing public health protocols and service and product delivery and so forth. The community, neighborhoods, and individual citizens that were equally involved in mitigation strategies. It was kind of interesting to see that some of those strategies involve neighborhoods and individuals that taking upon themselves to produce and provide masks to others to help out in different ways. There were other, of course, mitigation strategies that focused on mitigating the ill-being effects associated with the economic collapse, or at least the externalities associated with many of the public health system strategies. And again, here we have legislation provide direct COVID relief financial payments to at-risk populations, from tax regulations and obligations adjusted to support needed relief to families and workers, and a whole bunch of other types of mitigation strategies, all the way down to what we call socialized governments, which is kind of a very interesting concept that I learned about, again, from those countries that have instituted those strategies. Government officials coordinating with and mobilizing communities to meet urgent and essential needs. What wonderful, wonderful examples that we've seen in those many chapters that were written. And then, of course, we have the NGOs, from organizational philanthropy, trade associations and unions, religious organizations and faith-based groups, neighborhood coalitions and individuals, well, all they're equally involved in coming up with mitigation strategy. But most interestingly, in the analysis, uncovered what we call moderating factors, moderating in the sense that which strategies were effective under what conditions, and how can we move how can we set a future research agenda to allow academics as well as public policy analysts and economists and other social scientists and administrative scientists to test some of these very specific propositions. And I have a list here, as you can see from that slide. There's a whole bunch of moderators that tells us under what conditions certain mitigation strategies work best. So we have age, population density, refugees, migrants, and other vulnerable groups, the geographic locations, the way people greet others. that was kind of interesting. Religion, cultural values, from collectivism versus individualism, how those essentially affect those mitigation strategies. But most importantly, again, when we're focusing on those catalytic institutions, we're looking at, again, factors that would moderate the effectiveness of those mandated strategies, from the presence and absence of a universal healthcare system, for example, the trust and the distrust in the public health care system. Some countries were much more effective in enforcing those strategies, and of course, the enforcement of those strategies tend to be much more effective when you have citizens, when you have people in the community trusting, have trust in the public healthcare system, compared to, again, those people who are mistrusting. There are a whole bunch of other things, again, institutional factors related to government. I was thinking about what's happening in Lebanon, for example. The Koreans talked about, being a sectarian government and the political conflict. And of course, we learned from that situation, as well as the situation actually in Brazil and the United States, that political conflict is certainly a moderating factor that tends to either enhance or deter the effectiveness of those mitigation strategies. Well,
don't see any other question here. So if nobody has any other discussion points, we can indeed wrap up. Um, do any of the speakers have anything to add here?
Let me say something in terms of best practices. Among all the different chapters on the different countries, I believe that Rwanda did the best. So in terms of its best practices type of model, I salute Rwanda. I salute the Vatican City. They've done a tremendous job in terms of coming up with those mitigation interventions. Australia did very well, and Finland is also top rated. So again, I salute these countries and the people behind those interventions.